Welcome to side posture pull. The advantage of the pull stabilization over the push stabilization is the speed we could generate with the kick stabilization in our pull move. There's going to be some subtle differences on some positions I can show you with the leg, but the overall purpose of the pull stabilization is the same as it was in the push stabilization. We want to compress that leg towards the table to open up the joint or to prepare it for the adjustment while we create tension. So as we pan around, we'll get an opportunity to see the differences in the pull stabilization. Okay. In full spine, you're taught to stabilize the patient's thigh, the posterior lateral aspect of the thigh, with your foot wrapping around the anterior part of the tibia. We're going to demonstrate that now. Make sure that the leg you're standing on is very close to the table and very close to the area you're adjusting, so you don't have a very wide stance, so you have a very close stance with your center of gravity actually over the adjustment. Okay? When I bring the leg into position, I'm going to bring my leg up like this, and this is the position for the leg for the pull move. Again, the purpose of this is to push in towards the table like that. So I'm trying to compress the leg in towards the table like this, not down towards the ground. Trying to go in towards the table to open that joint up. Okay. The key is to keep your leg on the patient's posterior aspect of the thigh, not let it slide off onto the patient's lower leg, inner thigh here. There's a secondary position we can use. I find it very helpful, and it's my preferred position for my pull stabilization, so I can better control the thigh, the compression, and gives the patient more sense of stability on the table. So instead of my leg coming down the posterior aspect of the thigh here and wrapping around the anterior part of the tibia, I will keep my knee in the same place, and I will cross my tibia over the femur, over the anterior part of the thigh, and wrap my foot around the anterior part of the thigh here, the quadricep. Okay. Setup is very similar. Place my knee in the same place it was for position 1. Get the leg into position. When I get ready to stabilize, I'm going to cross over here. So you can see now that my tibia is crossing over the femur for the patient. I will preload the patient, compressing them in, and then kick and hold for the stabilization. Okay, so that's the subtle difference between those two. Come around, I'm going to pan back out. The stabilization for the patient, let's get you up on your shoulder a little bit more, Chris. When doing the pull stabilization, we're a little more compact with our body than we are with the push, and many people choose to use the arm or elbow stabilization. That is fine. The one thing you can't do is just hold the hands against the ribs like this to compress the patient's rib cage. You need to, if you're going to put this arm over the top and have them hold their elbow, that's acceptable, but you have to push this way. Or during the pull move, right up onto the shoulder, so again we could push I to S to traction the patient out to create more tension. So the difference between the push and the pull, speed for the pull, what type of patients do I use a pull on? That again depends on your body type and the patient's body type, whether they're very stiff through the pelvis and the spine or very loose or flexible. You'll just have to set up on the patient, see which move works best for you, either the push or the pull. See you in the next video.